Question: what are the common mechanisms of upper limb injuries? Answer: upper limb injuries can result from falls, sports-related trauma, direct blows, and motor vehicle accidents. Question: how are upper limb injuries classified based on anatomical location? Answer: upper limb injuries can be classified as shoulder, arm, elbow, forearm, wrist, and hand injuries based on their location. Question: what is the significance of clavicle fractures? Answer: clavicle fractures are common and can lead to shoulder instability, pain, and difficulty with arm movement. Question: how are scapular fractures managed? Answer: management of scapular fractures involves pain management, early mobilization, and addressing associated injuries. Question: what is the role of immobilization in upper limb fractures? Answer: immobilization with splints or casts helps stabilize fractures, prevent further injury, and promote proper healing. Question: how are upper limb dislocations managed? Answer: reduction of the dislocation, immobilization, pain management, and rehabilitation are key components of managing upper limb dislocations. Question: what is the significance of rotator cuff injuries? Answer: rotator cuff injuries can result in shoulder pain, weakness, and limited range of motion, requiring comprehensive assessment and rehabilitation. Question: how are fractures of the humerus managed? Answer: management depends on the location and severity of the fracture, ranging from non-operative treatment to surgical intervention. Question: what is the role of physical therapy in upper limb injury rehabilitation? Answer: physical therapy focuses on restoring strength, range of motion, and function in the upper limb after injury or surgery. Question: what is the significance of nerve injuries in upper limb trauma? Answer: nerve injuries can lead to sensory deficits, muscle weakness, and impaired function in the upper limb, necessitating prompt evaluation and potential surgical intervention. Question: how are fractures of the radius and ulna managed? Answer: treatment ranges from closed reduction and casting to surgical fixation, depending on the type and stability of the fracture. Question: what is the significance of compartment syndrome in forearm injuries? Answer: compartment syndrome involves increased pressure within a muscle compartment, potentially leading to tissue damage and requiring urgent intervention. Question: how are wrist fractures managed? Answer: management involves immobilization, closed reduction, and, in certain cases, surgical fixation to optimize wrist function and stability. Question: what is the role of hand therapy in upper limb injury rehabilitation? Answer: hand therapy focuses on improving hand and finger function, fine motor skills, and activities of daily living after upper limb injuries. Question: how are finger fractures and dislocations managed? Answer: management includes splinting, buddy taping, or surgical intervention, depending on the severity and stability of the injury. Question: what is the significance of mallet finger injuries? Answer: mallet finger injuries involve extensor tendon avulsion, leading to the inability to extend the distal finger joint. Treatment involves splinting and rehabilitation. Question: how are open fractures of the upper limb managed? Answer: open fractures require urgent wound care, administration of antibiotics, and surgical debridement to prevent infection and promote healing. Question: what is the role of imaging in upper limb injury assessment? Answer: X-rays, CT scans, and MRIs help visualize fractures, dislocations, ligament injuries, and soft tissue abnormalities in the upper limb. Question: how are upper limb injuries managed in athletes? Answer: athletes require specialized management that aims to restore function, prevent re-injury, and facilitate a safe return to sports. Question: what is the significance of thoracic outlet syndrome in upper limb trauma? Answer: thoracic outlet syndrome involves compression of nerves or blood vessels between the collarbone and first rib, leading to pain and neurological symptoms in the upper limb. Question: how are upper limb injuries managed in the elderly population? Answer: managing upper limb injuries in the elderly involves considering bone density, frailty, and functional goals in treatment decisions. Question: what is the role of regenerative therapies in upper limb injury management? Answer: regenerative therapies, such as platelet-rich plasma, PRP, injections, may aid in tissue healing and promote recovery in upper limb injuries. Question: how are upper limb injuries managed in pediatric patients? Answer: pediatric upper limb injuries require careful evaluation, immobilization, and monitoring to ensure proper growth and function. Question: what is the significance of brachial plexus injuries in upper limb trauma? Answer: brachial plexus injuries can lead to motor and sensory deficits in the upper limb, requiring accurate diagnosis and often surgical intervention. Question: How are upper limb injuries managed in pregnant women? Answer: Management involves considering both the safety of the mother and the fetus, balancing treatment options and rehabilitation. Question: What is the role of occupational therapy in upper limb injury rehabilitation? Answer: Occupational therapy focuses on improving activities of daily living and functional independence in individuals with upper limb injuries. Question: How are upper limb nerve injuries repaired? Answer: Nerve repair may involve direct suturing, nerve grafting, or nerve transfers, depending on the severity and location of the injury. Question: What is the significance of upper limb vascular injuries? Answer: Upper limb vascular injuries can lead to compromised blood flow, tissue ischemia, and require prompt surgical intervention to restore circulation. Question: How are upper limb injuries managed in patients with systemic diseases like diabetes? Answer: Managing upper limb injuries in patients with diabetes involves careful wound care, glycemic control, and potential collaboration with specialists. Question: What is the significance of upper limb injuries in polytrauma patients? Answer: Upper limb injuries in polytrauma cases must be evaluated and managed alongside other injuries, considering overall patient stability and priorities. Question: How are upper limb fractures managed in patients with osteoporosis? Answer: Managing upper limb fractures in patients with osteoporosis involves stabilizing fractures while considering the fragility of bones. Question: What is the significance of upper limb injuries in military or combat scenarios? Answer: Upper limb injuries in military settings require rapid assessment, stabilization, and evacuation to provide optimal care and preserve function. Question: How are upper limb injuries managed in patients with autoimmune disorders? Answer: Managing upper limb injuries in patients with autoimmune disorders involves addressing underlying immune-related issues while providing appropriate treatment. Question: What is the role of imaging-guided interventions in upper limb injury management? Answer: Interventions such as nerve blocks or injections guided by imaging can provide diagnostic information and targeted pain relief in upper limb injuries. Question: How are upper limb fractures managed in patients with previous orthopedic hardware? Answer: Managing upper limb fractures in patients with previous hardware requires careful planning to ensure stability and minimize complications. Question: What is the significance of upper limb injuries in industrial or workplace accidents? Answer: Upper limb injuries in workplace settings often require comprehensive evaluation, treatment, and may involve legal considerations. Question: How are upper limb injuries managed in patients with chronic pain conditions? Answer: Managing upper limb injuries in patients with chronic pain involves a multidisciplinary approach that addresses both the acute injury and chronic pain management. Question: What is the role of upper limb prosthetics in severe upper limb injuries? Answer: Upper limb prosthetics play a crucial role in restoring function and quality of life in patients with amputations or severe upper limb injuries. Question: How are upper limb injuries managed in patients with peripheral artery disease, PAD? Answer: Patients with PAD require careful assessment and vascular evaluation to determine appropriate treatment strategies for upper limb injuries. Question: What is the significance of upper limb injuries in geriatric patients? Answer: Upper limb injuries in geriatric patients require tailored management that considers factors such as bone health, functional status, and potential surgical risks.